I'm John Dickerson with YourPublicMoney.com. I'm glad to see retirees with good health care. That's not my issue. My concern is how the county has financed it. It's been said for years the county's cost is paid out of excess earnings in the pension fund. But the pension fund's own actuary says its 12-year return, not including last year's disaster, was 20% below its goal. If there were excess earnings, why was the county forced to borrow $110 million to eliminate unfunded pensions in '96 and '02? Unfunded pensions as of June would have been reported as $55 million, except you're changing the formulas to make it appear to be less. But the fund's real cash deficit was $110 million, and there's nothing you can do to change that. Unfunded pension obligations increased in 14 of the last 16 years, and the pension fund has always been underfunded. The claim that retiree health care was paid from excess earnings is absurd and indefensible given any definition of excess earnings that the public would accept. How could anyone up here tell the people with a straight face that $4 million or so of retiree health costs this year will be paid out of excess earnings when the fund was $130 million short of its target over the last 2 years? The policy's been that if the pension fund earns more than its target in any year, those excess earnings are swept out of the fund to pay retiree health care. That dooms the pension fund to be underfunded. It has to absorb its shortfalls, but can't keep its surplus. The county's retiree health cost has been funded by increasing unfunded pensions. Then the county borrows money to eliminate them, and that means that the ultimate source of the funds that have paid retiree health care will be cuts in staff and public services over the next 30 years so the debt can be paid.